There, how are you? It's John Campbell here, world-renowned healer and Rosslyn therapist. Now today guys, what I'm going to do is show you actually how to release the pressure from the knee. Now where we start actually isn't the knee, it's the ankle. Okay, so just gently, just finding the points either side, and that's where we are. Okay, either side, and just gently placing a tiny little bit of pressure there. And you can feel those tendons there which run all the way around over the top of the ankle, and then just a little bit of a gentle massage. Now this is just blood flow right now, and all you want is a tiny little bit of heat. Now as you can see, I've already put cream on the legs because I'm going to work on the whole of the leg in a minute. But as we have the cream on, it's so that you're not dragging the skin. It literally gives us that glide that we need so that we can actually work with the tendons here. Okay, now as we'll work below now, just taking the pressure off the tendon here, just below that area there, and just working like that, just below the ankle. Just taking the pressure off. That's it, that's nice and loose. But now as we come up, where we need to go into here is, I'll just move this up. We're not going right into the groin, we just need to get into here. And as we need to get into here, you can feel the tendon there is like very swollen, and also it's basically a little bit of like a ball in there. Okay, so this tendon here has been overworked or overstretched, and it's a tiny little bit of a problem. So now energetically we're just going to release that problem off, and it needs to come up over, back into the hip bone, over, back into the hip joint here. Okay, so now as you're looking at the knee, either side of the tendon, is we're not digging deep, all we're doing is just feeling where the tendon is, across over the top of the knee, and now we're just taking the pressure off the knee. Now the knee joint here is a tiny little bit of where the pressure is there, and now the knee's moved and it's released. That's it, released there, and that knee is free there now. Just by basically releasing the tendons off there, that knee is free. And now we'll come all the way down to here one more time, and we'll just make sure the tendon around the foot is nice and loose. So that knee there now is loose, and you can feel that looseness in the knee. Okay? And just a tiny little bit of a massage, just to get the blood flow and the heat to it, so that basically it's just going to sit there and just feel nice and happy. It's in a better position, it's in its proper position. And now, just around the calf, just getting the blood flow all the way down to the feet. So now we're going to do the same with this leg. And it takes no time. I mean, normally if you find if it's one knee problem, it affects both. So now same again, it's just basically just finding the tendon just underneath the ankle. There's the tendon there. Taking the pressure off, and now releasing it, and releasing it over. You can even just, if it's a little bit resistant, you can just grab the big toe and just go in a figure-8 circular motion, and just take the pressure off the tendon, just get it moving in a way that it normally wouldn't move, where it's quite nice. And now it's blood flow, just giving it a nice little massage up over the top of the foot and the bottom of the foot. And now that's loose. Now that tendon's loose there. I can feel that tendon loose there now. Okay, but now we need to go same. Okay, just up over here. Now I'm just going to put the point there, so obviously we're not being too obtrusive, but I just want for you just to get the fingers Just feeling the tendon. And as we find the tendon there, that's it there. And that just needs to roll over onto the hip joint. Just take the pressure off just underneath the hip, because obviously that's where the problem's been with this knee. And that's the tendons there, which basically activate the muscles. And now as we're coming up under the tendons that work around the knee, just taking the pressure off. There. Now, this knee has been quite a problem for a little while. So even though it wants to go back into position, it's been out for quite some time, so it's just going to be a tiny little bit resistant, but nothing that's going to be extreme. And it's nothing aggressive in this technique. It is actually very, very gentle. And if you were working aggressively, I can guarantee you it would be very, very painful for the person you're doing it for. So it's just a matter of that. You're just working around the knee, taking the pressure off, just massaging it back in, nice and gently. I want that knee freed here, just up the top of the knee. There. Now it's moved. Now it's moving. Now it's moving. You can say, well, the knee's at the front. Well, actually, the tendons are at the back. This is where the operational side is. And as the tendons are at the back of the knee, they literally connect into the knee joint itself. So now, as we're just loosening all of this off, nice and soft. As you can see, the cream helps. There's a nice glide. There's no effort at all. But now the base of the knee, it's moving in now, that beautiful little tendon. It's loose at the top, but now it's loosening at the bottom, just tiny little bit here, where it's slightly tight. That's it there, that's it loose. Now, I can move the whole of that joint now, and there's the kneecap, and the kneecap's rotating, it's free, and it's loose. But now, once more, you make sure is that just around the ankle joint, there's no tightness. Just below the ankle, and just now, just massaging that tendon into the foot because it's all connected up the leg, into the hip, all the way through the whole of the body. It's just like a piece of rope. As it's released in one point, it makes more room at the other. And there. Okay, move your knee. Free? Free. Thank you. And that is how you actually take the pressure off the knees, the hips, and the ankles. It's dead simple. Thank you.